Hi, my name is Haley and I'm going to be changing a dry sterile dressing. I'm first going to start out by washing my hands. Okay, now that I've washed my hands, I'm going to prepare my sterile field, in which I did, and I'm going to place my waterproof bag next to my equipment. I'm going to then identify the patient and explain to what I'm going to be doing. Can I have your first and last name and date of birth?
Santos Canales, 09/12/2001.
Okay, I'm going to be changing your dressing today. Is that okay?
Yes.
Okay. So I'm going to start by loosening the tape of the dressing, moving it towards the bandage and trying not to cause stress to the wound. So now I'm going to put on my gloves. Okay, now I'm going to remove the bandage and the dressing and place it into the biohazard bag. And don't cause any stress to the injury here. And if the wound is stuck to the bandage, I can pour in a small amount of solution and let it sit for a few minutes to let it absorb it and get soft. And then once the bandage is off, I would look for any kind of drainage and document the type of drainage and how much it's draining. And then just make sure that there's no discoloration or irregular drainage. And now I'm going to take off my gloves and wash my hands. Okay, I am now going to put on my sterile gloves. Okay, now that my gloves are on, I'm going to clean the wound site with the antiseptic solution as ordered. I'm gonna put that in my biohazard. I am now going to use my applicators. I'm going to apply the new sponges to the wound. Now I'm going to remove my gloves. I'm now going to secure my dressing, my self-adhesive bandage. And now that I've wrapped up my wound, I'm going to go ahead and dispose of my bag, my waterproof bag in the biohazard. I'm going to wash my hands. And I'm now going to document my procedure and describe the wound appearance and if there was any drainage, if there was any signs of infection, how it's healing, and any obvious signs that needed to be addressed. Thank you.